My name is Ted Morgan. I'm part of Greater Boston Urology in Plymouth. I have 3 children, one wonderful wife, and I've been here for 9 years. Born and raised in Philadelphia, Pennsylvania, and went to undergraduate school in the Philadelphia area, Philadelphia College of Pharmacy and Science. Was interested in dentistry and ultimately got talked into trying the med school approach. Joined the Army, did my residency within the Army at Walter Reed Medical Center, had a few years of payback. After I came out of the Army, I practiced for a very brief period of time in the Lancaster, Pennsylvania area, and then came up to the Plymouth area to work with someone that I met in med school, Craig Gillard, and we've been friends for 30 plus years. I'm very involved with my kids, with sports, coach, fanatic about getting them to keep moving on and trying harder and harder for themselves. I enjoy any outdoor 4-season activity, skiing in the winter, golf, beach, any activity during the summertime, but just being a dad. I think the breadth of our skill set between different providers learning from each other and equally different providers sharing their skills in order to provide the best team approach is what my goal is with Greater Boston Urology, and we're continuing to strive towards improvement of healthcare, particularly the South Shore and urologic skills. Urinary incontinence is a condition that afflicts many people of both genders, all ages. It can be from very small scale to very significant and affect their quality of life to the sense that they don't want to leave the house. The most common thing that we hear as urologists is that incontinence is something that happens as you age. And the reality is that while it may be common, it's not something that should be accepted as normal. Incontinence can be treated in very simple ways, lifestyle changes, diet changes, medicine changes, but the beginning is to ask for help. Some people it would be adding medicines, some people it could be exercise programs, rehabilitation of the muscles or the bladder activity muscles that you can modify if you learn how to modify them. In the arm of treatment, beyond lifestyle and behavioral changes, it can be new medicines that are given, and we're pretty hesitant to start new medicines because a lot of the medicines have side effects, particularly in the elderly population. There are things beyond medicines. There's therapies that are geared towards relaxing the nerves or decreasing the stimulus of the nerves. It's like an acupuncture therapy, which is an office-based therapy. There's more invasive things which are very effective, like Botox therapy, which is a common procedure. There's neurostimulation, which are implanted devices into patients. But typically those latter things, which are more invasive and more permanent, are not the normal thing. They're fairly rare to do. The one comment that I would have with any patient with a urologist is to always feel comfortable talking about things that affect your quality of life. The nicest thing about urology for me is that we can build relationships with patients and significantly improve their quality of life.